Oh, so you thought your doctor's visit started with the doctor? Nah, it started with us medical assistants. It's time for episode number 4. Let's talk about the check-in process, but with the medical assistance part. Let's get it. So you've been checked in at the front desk. You've waited in the waiting room. Now, one of us, medical assistants, have called your name. We said, come on back. Let's get you checked in and see the doctor. So this varies widely between offices and practices. Every MA and practice does things differently. Most practices typically start with your height and weight. Some people don't care about the height and weight. Some people do. It's kind of a requirement. We need to know these things. Doctors follow trends, and we want to know what your current stats are. It just is what it is. It's important to know if there's any major fluctuations in your weight specifically, because that can mean that there's something going on that you might not be aware of. But hey, that's why you're at the doctor, right? You'd be surprised on what medical conditions can be diagnosed with just your weight alone. I'm just saying, but we'll move on. So after we got that part out of the way, we take you to the room. And some places don't start with your weight. Most do. We get that out of the way because a lot of people don't like it, and we just get it done and over with so we can move on to the next. And plus, you're already standing and you have to stand for your weight, so we might as well just get that part done and over with. Anyways, let's go to the room. So you're in the room, you have a seat. You can have a seat on the table, on a chair, depends on the practice or the MA or however they place you, wherever you're comfortable. And again, it depends on the MA and the practice and how they handle things. Some will do your vitals first and then get your history last. Some will do your history first and then do your vitals last. It really depends on how they do their flow. Let's just say we do your vitals first. So your vitals consist of your blood pressure, your temperature, your pulse, which is your heart rate, your oxygen level, which is the oxygen in your blood, your respiration rate, which is how many times you take a deep breath in and out, and your height and weight. All of those measurements we are going to do every single visit. Again, doctors follow trends, and it's important for those trends to be followed to keep up with your current health status. What if your blood pressure is normally normal and today it's through the roof or it's super low? That can tell a lot about your current health status. So it's important for us to check it every single visit. Do you like it? No. But it's something that we have to do. If you come in and your temperature is high or super low, again, it makes a difference. That's why it's important for us to check every single visit, no matter what. Especially if you say you're not feeling well. It's especially important. It's also important when we're checking your vital signs to please retain from talking. Your blood pressure can actually fluctuate when you're talking or when you're standing or doing a whole bunch of extra stuff. So it's important to make sure that you are sitting still, sitting up straight, feet flat on the ground when we're taking your blood pressure and all the rest of your vitals, because that can vary with your results. Don't let nobody tell you different. Please be quiet while we're taking those results. It will vary significantly, trust me. So after we've taken your vital signs, or before, we like to get your health history. If you're a new patient, we have to go through the whole shebang. If you are a follow-up patient, we usually have everything in the system, but we do like to verify that we have everything correct and we haven't missed anything. If there's been any changes, we like to keep that updated. When it comes to your history, that includes your family history, meaning anybody in your family that you know of, usually your immediate family for the most part, but we also do ask about aunts, cousins, uncles, grandparents, just in the sense of any significant health conditions that might be pertaining to yours. So like diabetes, any cancers, things like that. Things that might be hereditary that can be passed down to you are most significant to be put in your family history. We also like to know about any previous surgeries that you've had in the past, if you can remember. Especially if we do not have your previous medical records, especially if you've been living in multiple states, things like that. If you have them, please let us know. Same thing with your allergies. We like to keep that up to date. Allergies are very important to know, especially when it comes to anything that might be prescribed to you in the near future. We need to know what you're allergic to. Same with if you were given an injection or an immunization. It's important for us to know your current allergies at all times, and also how severe that allergy is and what your reaction is to that particular allergen. We also ask you the reason for your visit, and please be descriptive. Most doctors only have time to go over one complaint per visit because time is limited, and we want to make sure that we can go over why you're being seen in detail and get it taken care of, but also so the visit doesn't go over and the doctor can see other patients in a timely manner. One of the most important but also the most complicated parts of the check-in process will be medications. The reason why I say that is because if you are taking medications, a lot of people do not have a list with them or don't remember the current medications that they're taking. So it is very, very imperative that you either bring a list with you or you bring pictures of the medications that you're taking with the name of the medication so we have it spelled correctly, the current dose, and what you're actually taking. Even if you're not taking it every day or how it's prescribed, we need to know exactly how it's being taken. And like I've mentioned before, I have a My Health Planner that I have made by hand that includes everything that we speak of right now, including your family history, your allergies, your medical history, all of your medications, that you can literally keep all of this information on your phone. You can print it out, write it out, and you can bring to all your visits. So all you have to do is give it to the medical assistant and we can just literally enter it in. It's easy peasy. But again, no pressure. But if you're interested, let me know. Link is in bio. It's imperative that you are being 100% honest about everything that you provide to the medical assistant prior to your visit, because the doctor is going to review all of this information and it lets the doctor know exactly where you stand from a health perspective. We also ask things about your social history. So do you drink caffeine? Do you drink alcohol? Do you smoke? Things like that. It's imperative that you're also honest about that. Even if there's drug use, we need to know. Remember, we're not here to shame you for your habits, but it's imperative that we know what's going on so we know the direction that we are going to take your health. The doctor's office is a judgment-free zone. At least it should be. And if you're in a doctor's office that is judging you based off of any of these things, leave immediately, because you don't deserve that kind of care. You can always change doctors and find someone who's not going to judge you for anything that you explain in these sections. It's imperative also to just be 100% thorough and honest with your medical assistant. We are not the enemy. We work directly with the doctor. So give us all the information that we need so that we can put in the system and also relay that to the doctor. But also try to keep it short and sweet, because we want you to see the doctor as quickly as you would like to see the doctor. So let's try to limit conversations to a minimum so that the doctor can come and see you and you can see them, because I'm sure you don't want to be here all day either, right? Whew, that was a lot. But hey, we do a lot as MAs. But now you're checked in. We've went through a lot, and sometimes this process can be pretty tedious, especially as a new patient when we have to go through every single step. But that's why it's so imperative for you to fill out your paperwork prior to, so that it will make this process so much faster and easier, and it limits the questions that we do have to ask. Oh yeah, we do ask about your shot records too, even as an adult. It's important. If I left out anything, We'll be back again in a minute. See you then.